So there's a couple of different causes. A physical cause would be like a tumor, scar tissue, inflammation, twisted bowel, or hernia, something that causes a physical obstruction. Another kind of cause is mechanical obstruction, which would be like a paralytic ileus, where peristalsis just stops. That movement just stops so that things can't move forward. Assessment: pain, progressive to severe, vomiting, and sometimes smelling of feces. Absent bowel sounds, which we have to listen for at least 5 minutes, right? And then abdominal distension. Diagnosis: this could be diagnosed by x-ray or CT. Consequences: we worry about ischemia and necrosis because, if those tissues are expanding to accommodate stool that's building up or a tumor that's applying this kind of pressure as well, that perfusion just can't happen to those tissues. So then we worry about ischemia and necrosis with that. And then people can also go into hypovolemia or shock, or if there's a perforation, then we worry about infection, hemorrhage, multiple organ failure, and even death. Interventions. So we anticipate an NG tube for decompression. So meaning they're going to have suction on to keep the stomach empty. Possibly surgery to remove the physical obstruction. We're going to monitor vital signs, eyes and nose, abdominal girth every 4 to 8 hours in centimeters. We want to see that progression. So there's my notes. Okay, paralytic ileus. This is paralysis of the intestinal wall. There's no physical obstruction. This is mechanical means. So causes, usually going to be general anesthesia is what we hear about it. Gastroenteritis, electrolyte imbalance, spinal or brain injuries or congenital defects can cause this as well, but general anesthesia is going to be the most common. Assessment: biggest one is going to be absent bowel sounds, and then no flatulence, meaning things aren't moving. Okay, they'll have abdominal pain, possibly cramping, vomiting, constipation. So interventions: bowel rest. Okay, this can take up to 72 hours after general anesthesia to resolve, and we do not want to progress their diet status until we know that their bowels are moving. So how do we know their bowels are moving? Well, we're going to listen and listen for bowel sounds, and then we're going to ask the patient if they're passing any flatulence. If they're doing either one of those, then they're moving. Then we can start to advance the diet. Otherwise, it's going to be NPO and possibly need an NG tube again for decompression. All right, irritable bowel syndrome. This is a motility disorder characterized by alternating periods of constipation and diarrhea. 20% of people in Western civilization have this. Causes: it is a CNS regulation of motor and sensory function that is altered. Eating, stress, hormones, drugs may have a greater response in people with IBS. Assessment: they can see excessive mucus secretion in the colon and in stools. Abdominal pain and tenderness, often in the lower right corner, with intermittent, dull, or continuous pain. May be relieved by defecation. They'll have irregular abdominal bloating and flatulence, some nausea and vomiting. Here's the key one: frequent changes in the consistency of stool. So they may go from very loose stools to constipation to very loose stools to constipation. Like, it's very hard to get to a regular. So straining, urgency, and sensation of incomplete evacuation is also common. So we need to rule things out. There is no specific diagnosis like, oh, yep, you got IBS. There's other things that can cause some of these symptoms that we have to rule out. So something that's going to be ordered is going to be a stool analysis. So we're going to be checking for occult blood, white blood cell counts, and an OMP, which is ovum and parasites. They may need a sigmoidoscopy or colonoscopy to measure that mucosa and pressures within the bowel. So remember I said, like, there's more mucus that is found in the bowel with people with IBS, so they're going to be looking for that. Small bowel series, so an upper GI into the small intestine, so that EGD, right, into the small intestine with or without barium. And if they have barium, make sure they get those laxatives and water. Treatments, nursing interventions. Goals are to relieve the symptoms and reduce or eliminate precipitating factors, so things that might trigger this. Stress reduction, exercise, and counseling may benefit the patient. Bulk forming laxatives like Metamucil or Fibercon have been known to be helpful. Selective serotonin reuptake inhibitors, those SSRIs, that is an antidepressant. An example of that would be sertraline. Tegaseride, this is a serotonin antagonist that's been known to help. And then here's this new one, linaclotide or Linzess. That is a new class of medication specific for the treatment of IBS. And then diet modifications, reducing dairy. Why reducing dairy? Well, dairy in the digestive tract creates mucus. It produces mucus. So if we reduce dairy, hopefully reducing that mucus production. Reduce in gas-forming foods like beans, cabbage, cauliflower, broccoli, things like that. Reduce fruits and berries and caffeinated drinks. Limited intake of sugars, especially those simple carbs. Herbs, these are alternative therapies. Peppermint oil has been known to help. Ginger, chamomile, valerian, or rosemary. Something else would be biofeedback training. So this is where your body gets a certain stimulus, and then you train your body into making a different response for it. So, maybe, this particular type of stimulus causes pain. So then you got to retrain your body to do something else with that stimulus. And so it takes a long time. And then hypnotherapy has also been shown to be effective. All right, here you guys, this should be all review here. Ulcerative colitis and Crohn's disease, these are both considered inflammatory bowel diseases. So the difference between the two, and you can kind of see in my little picture here, isn't that handy? Crohn's disease, this can happen anywhere in the bowel, and ulcerative colitis, this starts at the rectum and then it moves its way up the colon. So here's the definition of ulcerative colitis. It involves mucosal layers of the colon and rectum, primarily young populations affected, starts at the rectum and moves its way up. Mucosa becomes inflamed and edematous and bleeds easily, sloughs the mucosal layer. Manifestations 5 to 30 stools per day, blood and mucus in the stool, left lower quadrant pain relieved with defecation, weight loss, anemia, lower serum production levels, and then complications, toxic megacolon, massive hemorrhage, colon cancer. Why would people be having that left lower quadrant pain? Well, look at where the inflammation is at. It starts in that, rectum and colon, so that's going to be their left side. Crohn's disease, this is a relapsing disorder that affects any part of the GI tract from the mouth to the anus. Localized inflammatory lesions, manifestations, diarrhea, common but less severe, no obvious blood or mucus in the stool, right lower quadrant or central abdominal pain, significant weight loss, anemia, multiple nutrient deficits, fever, general malaise, and fatigue. So why do we see this wide array of different signs and symptoms and that kind of thing? It's because Crohn's disease can target anywhere in the digestive tract. And well, if it targets in the small bowel, that's where a lot of nutrient absorption is happening. And so if there's inflammation there, that's where you're going to start seeing weight loss issues or anemia or those nutritional deficits. It just depends on where the digestive system is being attacked with Crohn's disease. Complications, obstruction, fistula, abscess formation, malabsorption, and colon cancer. So fistula, this is an opening between two hollow areas. So this would be intestine to intestine. So say you can kind of see like here where the large intestine is kind of close to a small intestine. So what would happen is these would actually like form a hole between the two and they would be joined there. All right, there's that picture bigger. Okay, diverticulitis versus diverticulosis. Okay, diverticulosis. This is the condition of having small pouches called diverticula that form in the large bowel. So here's this picture, and the diverticula are these small little pouches that protrude off the colon. Okay, and having those, it's abnormal, and that's called having diverticulosis. Now, if those little pouches get infected and inflamed, then that person has diverticulitis, which is inflammation of the diverticulum. Okay, what causes them? It's believed to be caused by a low fiber diet and straining during bowel movements, postponing bowel movements, sedentary lifestyle, and common with aging. People with diverticulitis will often have left-sided to mild to severe pain, constipation, diarrhea, nausea, vomiting, and fever. They know that people with diverticulitis usually know when they're getting like an attack of their diverticulitis. Imaging, these are usually going to be diagnosed by colonoscopy or CT, depending on how bad and if they're looking for abscesses, that kind of thing. Consequences, if those little things rupture, that's called a perforation. Then we worry about hemorrhage, that fecal matter getting into the peritoneal cavity, which could be peritonitis. Threatening. Fistula formation, which is those two hollow spaces that are connected, and then bowel obstruction can happen. Treatment is going to be bowel rest. Antibiotic therapy is going to be paramount. They need to be NPO and possibly on parenteral nutrition. Interventions. So this is where it gets a little bit confusing. So for maintenance, for people with the diverticula, okay, that are not currently having inflammation and infection issues, need to have a high fiber diet. Think of that as the bulldozer, making sure things stay clear of those little diverticula. It's just moving the stuff on through. Okay, now if somebody's having an acute diverticulitis issue, then we want a low fiber diet. And that's to avoid getting fibrous material stuck in those little inflamed spaces that are, swollen, edematous, and will bleed easily. Avoiding seeds like popcorn, figs, berries, and sunflower seeds.